at the Armory now more than 2 years ago when this all started, it is never okay to take advantage of your community and your customers and your neighbors. It is illegal to try to take advantage of people in the middle of an emergency. We are still in an emergency, a civil preparedness emergency and a public health emergency. And it's illegal to charge prices far and above the normal retail price and what the market would normally bear. It is illegal to charge unconscionable prices. And this is the reason why we strengthened our state's price gouging laws last year. We have a lot more work to do. So let me tell you what's happening here in Connecticut. Since the pandemic started, we've seen upwards of just short of 800 complaints of price gouging. We look into every single one. What we found is that there are higher than normal prices. We do find that when people are trying to buy hand sanitizer, masks, both in retail stores and also online, that prices are definitely much higher. It's frustrating. At times it feels very wrong, and that's why we look into investigate every single one. What we're finding is that in most cases, after talking to the retailer, looking at the invoices from their suppliers, wholesalers, distributors, manufacturers, the prices that local retailers are paying for masks, for hand sanitizer, for test kits is much higher than normal. And unfortunately, under our state's price gouging law, we don't yet have the authority to go after the supplier, wholesaler, distributor, manufacturer. We don't have the ability to go up the chain. And so in the Office of the Attorney General, we have asked the legislature and the governor for that authority. A bill, I believe, passed the House last year, did not pass the other chamber. We're hopeful this year that that the legislature and the governor will give us that authority so we can go up the chain and take on potential price gouging up the stream of commerce at the supplier, wholesaler, and distributor and manufacturer level. Let me also note that with respect to test kits, we're seeing and we're hearing about a variety of potential misconduct and behavior that prejudices and harms consumers. Number one, of course, is higher than normal pricing and potential price gouging. You should report that to the Office of the Attorney General or the Department of Consumer Protection whenever you see it. Let me make a request, though. Please don't send us a photo on Twitter or Facebook. Please go to the website, make a complaint so we can talk to you about your experience. It doesn't really help to see something on social media. We need to have the ability to run that complaint down and understand what really happened there. Also, be aware of not just price gouging, but potentially bootleg test kits. So people buying test kits maybe in the gray or black market and then selling them online, Facebook Marketplace, eBay, out of the back of their trunk. Be very wary about buying bootleg test kits out there in the gray or black market. Another issue to really be concerned about is potentially fake test kits. We've heard some reports of that, so be careful about that. If you're going to buy test kits, please try to do so. You can sign up with the Postal Service now for test kits free from the federal government, but you should try to buy from a reputable in-store or online retailer. Please try not. I would be very skeptical of buying test kits which impact directly your health through more informal online sources like Facebook Marketplace or eBay. I would just be very careful about who you're buying those test kits from. And so with that, I want to thank Senator Blumenthal for drawing attention to all of this. Frankly, we can only do so much. We really need our federal partners, and I know Senator Blumenthal knows as a former Attorney General how important it is for states to have the authority to protect residents, and oftentimes that comes from federal statutes and federal initiatives. And with that, I'd like to turn it over to Senator Blumenthal. Thank you.
you. Thank you, Attorney General Tong. Thanks to you and your office for the great work you're doing, and thank you to this federally qualified health center. Charter Oak is really so incredible in the work that it does, along with the 16 other such facilities around the state of Connecticut. Among the hundreds of complaints filed by Connecticut residents is one from Julius in Shelton, who is 70 years old. He went with his 42-year-old son to try to find a test kit because the son was feeling under the weather. And he found one, but it was 3 or 4 times the price that he thought it should be. And Julius wrote to me saying, "We are being told to wear masks, get vaccinated, keep social distances, and get tested if you have any symptoms. We have done this and get hit with a $60 bill." I don't know who put the price of these tests at $60 each, but I believe we are being taken advantage of. There is nothing more than a crime being committed on the residents of Shelton and Connecticut. You are right, Julius. You are right, people of Connecticut and around the country. A crime is being committed on you by people who are price gouging at the expense of everyday Americans who have been told, get tested because you can keep yourself safe, go back to school, go back to work, go back to normal if you know whether you have been infected. These tests are not a luxury, not a convenience, they are a necessity. And that's why it is price gouging and predatory misconduct, illegal for someone to take advantage of these short supplies. Now, we know that pharmacy shelves are empty, state supplies are limited, and the scammers are exploiting the legitimate desire of people to be tested. Attorney General Tong has made the point that state law may not permit him and other law enforcers to go up the chain. If the pharmacies are being overcharged, their prices are going to be elevated. Federal law does permit going up the chain. It should be enforced. That's why I have written to the Federal Trade Commission, the enforcing agency, saying to them, do your job, go after these con artists and scammers. And the Federal Trade Commission should do so. I've been joined by my colleague, Senator Markey of Massachusetts, making this plea to the FTC. Do your job, go after the con artists, because everyday Americans like Julius in Shelton are paying too much. $60 is 3 or 4 times what the price should be. And now, fortunately, the federal government is doing its job in providing more supplies. The Postal Service has available 4 tests for every family, but again, the con artists are on their pernicious job. Just this morning, I've been alerted that there are fake websites for the Postal Service that are taking advantage of people who want to go to the Postal Service and providing them with no kits or fraudulent test kits. So there is no end to the ingenuity of con artists when they see a buck. And people should be careful when they go or think they are going to the Postal Service website. Make sure it's the right one. Avoid the bootleg tests, the fraudulent tests, the fake websites, and do your job as a consumer. Be careful and cautious. And I'm going to stay after the FTC, which can charge hefty penalties for first-time violations in the thousands of dollars, $5,000 per violation, when there are illegal conduct on the part of the suppliers as well as the retailers. At the end of the day, what we need is more test kits. The solution here, in the end, is more test kits. Ultimately, the federal government has to produce more of them, use the Defense Production Act, and make sure that there are enough of them so that there are no shortages to exploit by the con artists. But in the meantime, thanks to Attorney General Tong and our state of Connecticut for doing the work that it's doing to help protect consumers. And thanks again, Michelle, for the great work that you and your team are doing. Thanks. Any questions?
Yeah, I mean, unfortunately, well, like most families before Christmas, I talked to you, Susan, about getting ready for my mom's roast duck on Christmas Day. But before I could enjoy my mom's roast duck, my 97-year-old grandmother was going to be at dinner, so we were scrambling to find tests, at-home test kits, and there weren't any to buy. And then after Christmas, we were scrambling so that everybody could go back to work and kids could go back to school. And scammers know this. Attorney General Blumenthal, when he was in office, knew that when people were under a lot of pressure and there was a scarcity or an emergency, that's when scammers are most active. And now they have so many tools at their disposal. You know, going on Facebook Marketplace or eBay, you know, using robocalls, using emails, using text, all that's relatively cheap and easy. So scammers are able to prey upon us in a way that they haven't been able to before, which is why it's so important that we have every tool and every law enforcement agency, including the FTC, working together on this.
Yeah, you know, I think your point is an excellent one. We seem to be passing the peak and now maybe diminishing, we hope, in the Omicron variant. But let's face facts. We're going to continue testing. We're going to need to continue testing because we want to know, even as the numbers decline, whether someone has been infected so that we keep those numbers declining. We want kids back in school. We want people back at work. The best way to do it is to make sure they're not infected so they can go back to normal safely. And that's going to require continued testing as well as vaccination and boostering probably, and possibly mask wearing in certain situations like nursing homes. So we need to be in it for the long haul. And Attorney General Tong's absolutely right. The means of exploiting consumers are ever more sophisticated and ingenious. The technology enables it. But the tests are also becoming more sophisticated and reliable, so that I think pretty soon we'll have an at-home PCR test. We already have more and more reliable at-home tests. So we're talking about continued need for vigilance and law enforcement.
So the way it is now, we have in-home tests. Some of the health centers, charter offices, free for people who want to get tested, and some insurance companies pay for it, but hopefully things happen, right?
So there is a multitude of things happening. I'm happy you asked that question. The payment for testing is complicated. Earlier in the pandemic, the state had received federal funding to be able to cover costs for tests, but now there is no federal funding to cover the cost for tests. So some insurance companies are covering the cost for tests. If the insurance companies deny payment, then the individual is responsible for covering out of pocket. Federally qualified health centers do not turn anyone away, so we see people regardless of their ability to pay.
What has Trump heard in terms of
It's fortunately for us, we haven't heard a lot because we provide access to testing. And because we provide access to testing, people will they know they can come here to get tested. I think it would be a different story if we were one of the health centers that were not providing access to tests. So we do have some tests that we can hand out. When those are gone, people are free to come and get tested here. Even though people can get the antigen test, they still want to get the PCR test as well. So we haven't been hearing too many stories from our patients because they know that they still have access to testing here. Yes, and you know, even my mom, who wanted to get a test on a weekend, went to her urgent care, and they told her she had to pay out of pocket up front. So the cost and payment for testing has become complicated, and I think that might be somewhat of a barrier for people because they are confused about whether or not they're going to have to pay up front before they get tested.